Hi, everyone. I'm Dr. Samantha, and welcome back to another one of our live Q&As here at the Maternity Mentor. We're here every Monday at 9 p.m. Eastern Standard Time to answer your questions live and to also answer questions that you have submitted over on the channel on our videos and stuff. Please remember that we are also on Facebook, Instagram, and Twitter for additional content. Those will be linked into the description. Please make sure you share the channel with your friends and family. And remember, it really helps us when you like and subscribe and hit the notification button. And for those of you who stick to the end, I'll give you a sneak peek at tomorrow's video. So stay with us. Remember, if you're joining, you can put any questions that you have into the chat. I always like to go ahead and get started right away with some of the questions that we get onto the channel. So I'm going to go ahead and get started. We got an interesting question this week. Why do blood transfusions induce labor pains in pregnant women? And I thought that this was a very interesting question. So I'm going to go ahead and get started with this one. So what I would and unfortunately, I'm not going to be able to answer this one completely accurately because I think there was a little bit of a translation issue. But when I think of labor pains, I'm thinking of contractions. I'm thinking of those uterine contractions that we feel where the belly hardens and it stays tight and it feels like a cramping pain. So that's what I consider to be labor pains. Now, a blood transfusion after delivery often happens because there's been a postpartum hemorrhage. And we have a video on this that we'll link into the description. Postpartum hemorrhages happen because the blood vessels in the uterus don't close off properly. So let me explain. You have your uterus, and attached to the uterus is the placenta, okay? The placenta is the organ that feeds the baby. That's where the umbilical cord is attached to the baby's belly button. The back side of the placenta is all blood vessels, okay? These need to be open blood vessels to attach basically to blood vessels in the maternal system, okay? So the uterine wall is also open blood vessels. So when the placenta delivers and comes out, this part of your uterine wall is exposed open blood vessels. So very quickly, your body needs to clamp these shut and it needs to clot off so that you don't bleed to death, okay? When you're bleeding excessively after birth, it's because these haven't shut down and closed off. One of the things that can cause this is a piece of retained placenta. That means part of this placenta broke off and is lodged into the wall, and that will keep your uterus from contracting back down and stopping you, bleeding. So when you're bleeding too much, your uterus is trying to contract against that to try to get this to close off. The only thing I can think of with this question is that the blood transfusion was given during the time post-delivery when the uterus is trying to contract back down. As a result, the body is simultaneously trying to create homeostasis and stop bleeding while that transfusion is coming in. That might be what causes it. The only other thing that you should be aware of is when you are receiving is a possibility that you might get a blood transfusion reaction. And blood transfusion reactions can sometimes be represented by a lot of different things, including like sweating, fever, shakiness, maybe even some cramps. So that may or may not have been what this person was referring to. I'm going to go ahead and I'm going to talk about the next one. We had a question on the C-section video. It says, my wounds continue to get infected. After the medication, I feel well, but then I experience the infection again. So I love these infection questions, and I think that it's really important to get this one answered. So infections. We get a lot of infections during pregnancy and postpartum. And when we need to get those treated, some of them will require antibiotics. That's because a bacterial infection has been noticed. Once you're given antibiotics, it's extremely important you take all the antibiotics. If you don't take them all, the infection will come back. And this may have been what happened in this case. So the infection, when you first take an antibiotic, there's like, say, a whole bunch of bacteria, and the antibiotic kills like a whole bunch, but there's still some back here that are like the strongest, toughest ones. But the thing is, when you kill off the first round, you feel better. So a lot of people will stop taking their medicine thinking they're all set. And really, that those few in the back, they're just building up defenses and figuring out how to get around the antibiotic. And then they start to multiply. And the next thing you know, you're sick again. So it's very important to take all your medication as prescribed. Now let's talk about C-section infections. So the C-section scar is very, very, very low. And most women after a C-section will have this like overhang of belly, okay? We all kind of, your belly isn't flat when you leave the hospital. In fact, you look kind of like you're still pregnant. And your belly, it overhangs. And there's this crevice under here, right, where your C-section lives. So when you're going to clean yourself, you need to lift up your belly like this, expose the C-section, and make sure this part gets cleaned well. Now, how do you clean it? You can't scrub it. That would actually open it up, cause irritation, may even increase the risk of infection. So instead, when you lift it up, you need to spray it down with like soapy water and then spray it down with like clear water. And then you might even want to just pat it dry afterwards, okay? That C-section incision, you don't want to use any powders or any lotions. A lot of those have sugars in them that can actually cause infection. So you want to make sure you keep this clean and dry. If your overhang is particularly big, you need to open this up and give it air 5 or 6 times a day. Now, one of the things we take for granted is you need to wash your hands, okay? Now, a lot of times we think about washing hands when we're using the bathroom. That makes sense, right? But some people don't think about washing their hands after they've, say, changed their baby's diaper. Okay. I know it seems maybe instinctual or obvious to some people, but to other people, it doesn't. And when you're sleep deprived, it doesn't matter. You may think you washed your hands and you didn't. What you need to understand is when you're caring for that C-section incision, it's at high risk for an infection because it's a warm, dark, moist area under there. And so as a result, it's at a higher risk for infection. So you want to make sure you're washing your hands before you do this. Keep it clean and dry. No lotion, no powder. Finally, if you've been doing all of this and you've been taking care of your incision and you received medications and you took them all and it still came back, you need to ask your doctor to send you to an infectious disease specialist. These are the guys that can culture what that drainage and infection is and figure out what the best antibiotic to use is. They also need to look at the incision itself. I had a patient recently who was still having incision issues after 4 weeks post-delivery, and it turned out her stitches weren't dissolving. So she had had an allergic reaction to her stitches. It's extremely rare, but her stitches weren't dissolving and they needed to deal with that. And that's what was causing the repeated infections. So it's very important to go ahead and get that checked out. So that was a great question. I have a question that came in about gestational diabetes and a glucose tolerance test. I think I'm going to hold off on that for just a minute, but if my viewer is on who asked that, please let me know in the chat. All right, so keto. The ketogenic diet is one of my favorite things. I put out a video on it, and I want to answer this question. Can I follow dirty keto during pregnancy? And will this be safe for me and my baby? I mean, I do keto, I think is what she was trying to say. But I eat more strawberry and avocado with heavy cream with keto sugar. Can I follow this system? Okay, so for those of you who don't know what the ketogenic diet is, it's a diet that's low in carbs, which are sugars, and high in healthy fats and protein. The ketogenic diet is one of my favorite diets because I think it is the closest to how we used to eat when we were cavemen. And I truly believe that our bodies and our parenting instincts and everything about family and child development and this whole area, mental health even, is all related to us going back to our roots as cavemen. And so when we were cavemen, we ate primarily protein. What we got, what we killed, we ate. And that protein came with healthy fats, okay? The fat from the animal, the marrow, the everything. And that was our primary source of dietary nutrition. Now, along the way, we would also eat carbs. We would eat flowers and berries and fruits that we would find and gather and just eat. We eat very little fiber. This whole fiber thing that we see everywhere, that didn't really exist in our diets. So this was what we ate. And I think our bodies respond naturally very well to this. Well, the ketogenic diet is also extremely good if you think that you have gestational diabetes or at risk for developing gestational diabetes. Remember, gestational diabetes is where you have too much sugar in your system and then your insulin response is poor. Insulin is the hormone that helps us use sugar in our body. So when we eat a low carb diet, we help to improve our glycemic index, which is basically like a measure of our sugar control, which can help reduce diabetes. And diabetes has a whole bunch of risk factors when you're pregnant. And we have some videos on that we can link into the description. Back to keto. Keto, being a low carb diet, is ideal for pregnancy, in my opinion. Dirty keto is, in my opinion, an easier and more sustainable way to follow the ketogenic diet. If you do true keto, if you guys start doing all sorts of research, they want you to like count macros and do all these calculations. I think it is extremely complicated and it can be very discouraging. Instead, dirty keto involves finding a keto list, a keto-friendly food list. You can go on anywhere and find a whole bunch of foods. You're going to find that most of them are whole foods. They're not processed. Stick to that list of foods. Don't eat anything that's not on that list unless you've been told to by your doctor. And eat those in moderation, okay? This doesn't need to involve calorie counting or anything like that. Just stick to those lists. There are lower glycemic index and eat in moderation. And you'll find that this can be extremely healthy for your pregnancy. Now, this person said, I eat more sugar and avocado with heavy cream and keto sugar. That's all fine. Strawberries are good. Heavy cream is good. Avocado's good. Keto sugar is fine. It's moderation that's key. All right. And that's the biggest thing for you guys to know. And anybody who's on who doesn't know a lot about diet, the biggest thing, a lot of people, they see the keto diet, they like most of the stuff, but then they see dairy. And one of the things with dairy when you're doing some of these diets is you need to use whole fat dairy, which is just completely different than most of us in the US and other Western countries are used to. Everybody sells us fat-free dairy, fat-free milk, fat-free yogurt. When you take a glass of whole milk and a glass of fat-free milk, we're talking about cow's milk. Sorry. What happened is if you look at that milk, the whole milk is thicker and it's white. The fat-free milk is thinner and it's almost a gray color. That's because the fat is what makes that milk thin and white, right? That fat-free milk is now basically sugar, and that's what people don't realize. Whole fat milk, yes, it does have more calories. It does have some cholesterol. It has protein and healthy animal fats. If you take that stuff out, you're left with a glass of sugar water. Lactase, that's sugar. And that's why the fat-free dairy products are actually not that good for you. I'm not telling you to eat tons and tons of dairy, but if you're going to eat it, eat the whole fat kind. Don't do the fat-free. Going to my gestational diabetes question. So this was a question that I really liked, and I think it's really, really important for us all to hear. And by the way, any of you who are joining us, please feel free to put any questions you have into the chat. That's what I'm here for, okay? So I didn't pass my 1-hour glucose test. I was shocked. I was not overweight when I started this pregnancy, 120 pounds. I don't have a history of diabetes, nor does it run in my family. I've been on a semi-keto diet and have been depriving myself of cravings like sweets and fast foods. I'm over the age of 35, and this is my first pregnancy, what are the chances of passing the 3-hour glucose test? And is there anything I can do ahead of time to prepare? So this is a fabulous question. I hope Gabrielle is listening. If she's not, I will make sure she gets this answer. So when you're pregnant, usually around the 28th week, they do the gestational diabetes test. What this test involves is you drink this sugary, nasty, thick kind of drink, and they will then draw your blood an hour later, okay? And they see what your sugar level is, okay? If the sugar level is within a certain range, you pass it. And if the sugar level is more than that, you fail. Now, what is kind of getting ready to change is that traditionally in the past, if you failed the 1 hour, they made you repeat the test and do 3 hours. So they draw your blood ahead of time, then they draw it at 1 hour, 2 hour, and 3 hour. And then they take those numbers, and each hour has a range that's normal. If 2 out of the 3 are abnormal, you fail and you're diagnosed with gestational diabetes. I'm going to tell you that there's a lot of talk about getting rid of the 3 hour. And there's a lot of talk now that if you fail the 1 hour, you should be considered diabetic and they should start treatment accordingly. I will tell you, based off of all the things that I have seen in the hospital working with women with gestational diabetes who are pregnant, we're trying to keep you pregnant, based off of working in the neonatal ICU and in mother-baby with diabetic babies, I think that that's how it should be. I believe that once a woman has failed the 1 hour glucose tolerance test, she should be considered diabetic and treatment should start accordingly. To answer the question about, is there anything you can do ahead of time? No. One of the things that we do for just standard adults is a blood test called an HbA1c. And an HbA1c measures your glucose control over 3 months. So even though you tested today, it's telling us how your sugar control looked for the past 3 months, okay? So there's nothing you can do to change that other than in the now eating right. So it's important for you guys to understand that most tests that you're getting related to sugar, that's testing for diabetes, what you needed to do to change it needed to happen months before and not the night before anything. Now, as far as eating the keto diet, I just told you guys, the keto diet is amazing. It's a low carb lifestyle and everything is really good with that. But there's a lot of hidden carbs in our life. So what people need to understand is there are spices that they will shake on your steak at, say, a restaurant that have sugar in them. Salad dressings, notorious for sugar. And people will go, oh, but wait, Samantha, I eat vinegar, oil and vinegar. Most vinegars are full of sugar. You are better off to eat the cream-based salad dressings. And this is the thing. It's a shift in your brain as to what actually looks good. And then if you look at some of these salad's a great example. If you go to some of these restaurants to order some of these salads, you can even get a salad that looks really keto friendly. Some of these salads are 1,500 or 1,800 calories. So it doesn't matter if it's completely keto friendly. If you eat one of those plus 2 other regular meals in a day, that's still way too many calories. And ultimately, everything kind of turns into sugar at the end. Okay. Everything gets reprocessed to give you glucose to run your body. Okay. So in my opinion, you should be considering yourself diabetic. They may go ahead and do the 3-hour glucose and they may tell you that you're not. But what a lot of us in the biz kind of know is that it seems like you'll have these moms come in and they tell us, oh, I failed my 1 hour, but I passed the 3 hours, so I don't have diabetes. And their babies are born large for gestational age. And please, please watch the video on gestational diabetes. It gives you a lot of this information. And LGA babies, large for gestational age, there's a lot of risks with these babies. They have trouble eating. They often go to the ICU for IV antibiotics and different things. IV sugar because they can't regulate their own sugar. So what can you do? Whether you pass this 3-hour glucose or not, it's time to start looking very carefully at your diet. Okay, you can do diet controlled diabetes during pregnancy. Usually, we limit women to about 24 to 2,600 calories or less per day, and we try to focus on whole nutrient, low carb meals. So again, whole proteins, whole, lots of dairy, lots of meats. Okay, but you want to be very careful to balance it out. If you like dairy, whole fat dairy. And listen, every once in a while, you're going to need a cheat day. So I want you to use those cheat days so the other days it's going to be easier for you. If you do fail the diabetes screen, the 3-hour diabetic screen, the other thing you guys should be aware of is that we really traditionally do not treat diabetes during pregnancy with pills. So an adult diabetic might receive a wide variety of stuff, including metformin and glucophage and other things, right? We do not do that in pregnancy. Pregnancy, you go straight to insulin. If you need medication, you're getting insulin. I beg any of you who are diagnosed with diabetes to take the insulin if it's offered to you. It's extremely important for your baby's safety that we get your blood sugars under control immediately. And so it's vital that we use insulin. You also want to keep the diabetes under control to the best of your ability because you will now be at risk for developing diabetes after your pregnancy. Women who have gestational diabetes are at a higher likelihood to develop diabetes postpartum. And so if we keep your sugars under control, you're well managed, everything looks good, you have less of a chance of that happening. So don't look at insulin as your enemy, look at it as your friend. The other thing is, and I've been thinking about doing a video just on this, it's important for you guys to understand that you're going to need to check your blood sugar. One of the things that I want to tell you when you're going to do your 3-hour glucose tolerance test, and anybody who's getting their blood drawn, when you wipe your finger with alcohol or when they wipe your arm with alcohol to do a blood test, alcohol is sugar. Let me repeat that. Alcohol is sugar. So when you're diabetic, we need you to test your sugars multiple times per day. We usually have you do it in the morning, which is called fasting. Then we have you do it 2 hours after breakfast, 2 hours after lunch, 2 hours after dinner, and then usually at bedtime. We're looking to see the trends of your sugars over the day. This helps us decide if we're going to use medication and titrate the medication we're giving you. When you go ahead to do your blood sugar testing, and this is what I've been thinking about doing a video, you're supposed to wipe your finger with alcohol. Now, then what you're supposed to do is let it air dry. You don't blow on it, you just let it air dry. Some people use a sterile piece of gauze to wipe it dry, but you need to wipe this to clean it, right? Now, then you stick your finger to get the drop of blood, and you squeeze the drop of blood. In the hospital, we squeeze the drop of blood and we wipe it away. We do not use that first drop of blood. Why? Because alcohol is sugar. So if there's any sugar that's left over on your skin, right here, we're wiping that away. It's taken away with that drop of blood. So that drop of blood, which could be inaccurate, is not used. And then we use the second drop of blood. So it's also important for you guys who are getting sugar tests to understand how they should be drawing your blood. When they wipe your skin with alcohol, make sure they either let it dry or they wipe it with gauze before they stick you, and that way they'll be getting an accurate measurement. So I hope that answered your question, and I hope you're on, Gabriella. If anybody has joined us, please feel free to put some of your questions into the chat. We got a question this week on the depression video that was, I think, a really good one. I am taking quetiapine for 2 years for bipolar disease. Does it have bad effects on my pregnancy? I'm pregnant 8 weeks and I'm really worried it will affect my baby in the short or long term. So many of you guys may know I'm a psychiatric nurse practitioner. I started in labor and delivery and mother baby, and I moved into the psychiatry realm because I saw families and moms who are pregnant and moms who are breastfeeding not getting the care that they needed for their depression and anxiety. So this is very much a passion area for me. This is what I do every day now that I'm working. I'm working with these types of families. Quetiapine is also known as Seroquel, one of my favorite drugs of all time. Okay, so Seroquel, for those of you who don't know, is an antipsychotic. Antipsychotics sound scary, and they really aren't. These are medications that we use to treat bipolar. We also use it to treat schizophrenia. It can be used for some depression, anxiety. I love it for a little bit of sleep because it has a nice side effect of sleepiness for a lot of people. So Seroquel is absolutely one of my favorites. Seroquel can be used during pregnancy. And right now, what you guys need to know about medications, we cannot do studies on pregnant women or women who are breastfeeding. It's not ethical. But what we do is we aggregate animal studies. We look at women who've taken stuff where their data has been submitted to databases, and we just try to get the best safety profile we can. As of right now, there's no evidence that Seroquel causes any birth defects whatsoever. So for a mom who's got bipolar disease, who needs to take something like a medication like Seroquel, to take Seroquel for their bipolar disease, this is a great medication to take. Now, there is some risks. The antipsychotics tend to have a risk of weight gain, and they also tend to have a risk for you developing hypertension or diabetes, okay? So when you're taking Seroquel during your pregnancy, there's an increased risk that your baby might be LGA, again, large for gestational age. There's a risk that you might develop diabetes, and there's a risk for a thromboembolic event. That means you might develop a blood clot. If you are at risk for blood clots, what you want to do is you want to go ahead and ask your healthcare provider to recommend that you see a maternal fetal medicine doctor. These are the specialists that deal with high-risk pregnancies. They will most likely tell you to take a baby aspirin, and that should reduce that risk. They may also ask you to take something more. They may decide to do some blood clotting studies to just determine your risk, and you may be put on a different medication, but most likely that's it. As far as the diabetes stuff, well, we kind of started talking about it. It looks like I might have some questions in the chat about it, which I will answer. But basically, you want to make sure your blood sugar is under control and you're eating a low-carb diet, and that can help that. Finally, antipsychotics, again, are used to treat bipolar disease very, very commonly. And so one of the reasons why Seroquel is so safe is that it seems that there's not a lot of the Seroquel that passes through the placenta into the baby. That's why it's one of the safest medications we use. I've used it in the middle of pregnancies to help treat insomnia. We can use it for postpartum psychosis. And again, it can be used to help you sleep. It's one of my go-tos. I love it. And for those of you who are wondering, it is also safe for breastfeeding. And for some of my moms who are having severe postpartum insomnia due to anxiety, Seroquel really fits the bill for that too. So it's a great drug. All right. So I see a question from Stephanie. Hi, Stephanie. Immediately after delivery with gestational diabetes, can I eat normally? If so, what's acceptable blood sugar reading postpartum? Oh, okay. So can you eat normally? Yes, you can. If you are breastfeeding, there's the whole you can eat up to 500 calories extra per day to make breast milk. I wouldn't do that. I would just eat normally. I wouldn't kind of give yourself permission to eat extra. I always think that we should be eating lower carb. So you definitely want to try to stick to like the more keto friendly types of foods. Normal acceptable blood sugar reading. This one's a hard one. It's a very dependent factor. It would be dependent on breastfeeding, metabolism. I would say, and then of course your weight's changing, you've got some hormonal shifts. This is not a hard, fast rule. An endocrinologist who's looking at you specifically in your health profile and all sorts of other stuff is the one who can make the final determination. But my guess is a 2-hour post meal should be about 150 or less around 8 weeks postpartum. The first 8 weeks, too many things are in flux. It's just everything is crazy wild. In fact, a lot of women who are taking insulin during their pregnancy, they actually stop taking insulin immediately postpartum. Like, we just stop it. And that's because the body is starting to go through such rapid shifts that sometimes if you're giving insulin, you're going to drop moms way too fast. It's actually better for you to have higher sugar than to be plummeting with the sugar. So a lot of times we just stop insulin and we see how things land. And Stephanie, a lot of moms will go back to eating normally and basically the diabetes will be gone almost instantly. Jasmine. Okay, your info on gestational diabetes was great. Thank you. My last baby was born at 9 pounds, 5 ounces. My 1 hour glucose test was negative. I'm pregnant with my next baby, and the 1 hour was at the number where it shifts to pass or fail, but the 3 hour levels all passed. My ultrasound measured in the 75th percentile. Could I possibly have large babies, but not due to sugar issues? Should I still be concerned? I'm due on December 27th, and I'm very nervous about myself, my 22-month-old, and my husband being sick when it's time to deliver. Do you have any suggestions for navigating the holidays? Okay, so Jasmine, if you or your husband have a history in your family of large babies, or you are large people, maybe you just have large babies. However, almost exactly what happened to you with your first baby is why I say if you fail the 1 hour glucose, you should be considered diabetic, because that's exactly what we see. We have moms who fail the 1 hour, they go back in, they take a 3 hour and everything looks good. Why one day it's a fail and one day it's a pass, I can't answer that part. But then what happens, they have these big, giant babies, which are put at risk for a lot of things, like possibly needing a C-section, shoulder dystocia, sugar issues for the baby, poor breastfeeding, all sorts of different things. So I would tell you that it is possible that you have larger babies that have nothing to do with sugar. I would just be mindful of your diet. They're not going to retest you. They're not going to change anything unless you start to develop a complication. 75th percentile is not terrible. I mean, if the baby looks healthy, all you can do is try to keep your carb load to a minimum. Now, your question about staying healthy during the holidays. Oh my gosh, guys. This is going to be challenging. I'm going to tell you that every day now, I am hearing multiple stories of families telling me the kids are sick with this or the adults are sick with this. So right now, the flu is going around, COVID's going around, RSV is going around, strep throat's going around that I know of right in my community. And this is going on really all over the place. So what can you do? For those of you who aren't vaccinated for the flu or for COVID, I would tell you to go get vaccinated. I know this is a very controversial statement, so let me explain. I'm going to tell you that personally, for many, many years, I did not get the flu vaccine, and I did not get it for my family. I was like most of you. People still get the flu with the flu vaccine. Why would I get a flu vaccine if I'm still going to get the flu? It wasn't until COVID, guys, that I started to really understand fully the mechanism of action for the COVID vaccine, for vaccines in general. So the vaccine is designed not to prevent a disease, but it's not designed to prevent a disease, but to reduce your risk. Okay. So you hear this with the elderly people. They talk about how elderly people, it will reduce their risk of death and it will reduce their risk of being hospitalized. Okay. And the reason why this happens is it basically primes the body so that the body gets a little tiny piece of this virus and it goes, oh, let me make antibodies for this so that, I can kill this off. Okay. So when you get exposed to the illness, your body can attack it more effectively and therefore reduce your risk of developing full-blown disease and ending up in the hospital. Pregnant women are immunocompromised. Let me repeat that. Pregnant women are immunocompromised. We treat pregnant women very carefully in the hospital. Most units do not allow the nurses to wear watches. We're not allowed to wear rings. We have to be very careful with our nails because we do not want to bring any infection to pregnant women. Okay? Your body has to have a reduced immune system. Why? Because if our immune system was on full alert, our immune system would try to attack our babies. Remember, your baby is half your genetic material, but it is half of your partner's genetic material. And your partner's genetic material is a foreign body inside your body. So, in order to protect our babies, our immune system has to be suppressed so it doesn't attack that baby. So, we're at risk. All of our resources are going to growing a human being. I have seen many pregnant women in the hospital who have not done well with the flu. Okay. We're going to leave controversial COVID out of this. I've seen women end up in the ICU. I've seen emergency C-sections, and I have seen maternal death. This is not meant to be some doom and gloom thing. This is to tell you what I have seen. The flu vaccine you receive will not be perfect. You may get the flu. It will hopefully reduce your risk of serious illness or death. Again, the COVID vaccine will not be perfect, and you may still get COVID, but it will reduce your risk. Now, I would not get both vaccines on the same day. In fact, I think vaccines should be separated, and I usually recommend by 1 to 2 weeks. Okay, the new COVID vaccine is out, the new booster is out, which is protecting against the current variant, is what they've said. So there was a new vaccine booster that came out in September. It's very important for you to talk to your healthcare provider before you just go get vaccinated. There are certain people that the vaccine is more risky than staying unvaccinated. So you might be one of them. Now, how else to protect yourself? You want to talk to your healthcare provider, but I'm going to give you the vitamins that we used to use to protect our COVID patients' immune systems. And they're pretty basic. So zinc, vitamin C, vitamin D, and melatonin. Sorry. Okay. So zinc is very well known to be a powerful immune system booster. Okay. You cannot take more than 50 milligrams per day, and pregnant women shouldn't be taking that much. You need to ask your healthcare provider, but usually pregnant women can take 15 to 30. Okay. But again, you need to ask your healthcare provider. Vitamin C, everybody's well known about vitamin C. It is extremely good for your immune system. Now, some of your doctors may tell you to take 1,000 milligrams of vitamin C. Do not take it all at the same time. In fact, if you can take 250 milligrams 4 times a day, that would be the best way. Because see, vitamin C is a water-soluble vitamin. Whatever you don't need right at that moment, your body's going to get rid of. So if you take 1,000 and you only needed 10, you're going to pee out the rest of it. If you take 250 spread out, you may be able to use more of it. Vitamin D is essential. Vitamin D does not only help your bones, it helps your brain, it helps your mood, it helps your concentration, and it's a powerful immune system booster. Vitamin D, 2,000 international units a day is very common. Check your prenatal vitamin. It may have all you need. And finally, melatonin. We think of melatonin as sleep. What you guys need to understand is, yes, melatonin is a hormone that helps us sleep. But if you read the research all over the world, melatonin was being used in multiple countries in many hospitals as part of their treatment for COVID patients. Melatonin is a fantastic immune system booster. You can take as little as 1 to 3 milligrams, and that's just enough to help boost your immune system to help keep you healthy. Okay, when you're around people during the holiday season, if somebody tells you it's allergies, tell them no, they can't be around you. Nobody has allergies at the holidays. It's sick. I just, nobody with sniffles, nobody with coughs, nobody with anything. You need to just stay kind of healthy. When COVID was happening, a lot of us turned our parties to the outdoors. This actually makes a lot of sense. The more open air, the better. If you're in warmer climates, try to do barbecues and stuff like that. If you're in a colder climate, just try to limit the amount of people that are there. That being said, try to understand also that as much as I'm advocating for you to keep your immune system healthy, to vaccinate and stuff. It's the holidays and you want to be around your family. It's really okay for you to do little short periods of time, hopefully, with your family. And just the biggest thing is ask everybody, please don't come around if you're sick or if you've been around somebody who's sick. That little tiny common sense thing can go a long way. Okay. And I hope that helped, Jasmine. Please feel free to ask more. For those of you who are joining us, my name is Dr. Samantha. Hi, I'm the maternity mentor. We're here every Monday at 9 p.m. Eastern Standard answering your questions. So please feel free to put them into the chat. And I'm going to keep going with some of the other questions. You're welcome, Jasmine. We got a question about Vibriid on the depression video. Vibriid is also called Vilazodone. It's an antidepressant that also treats anxiety. And it said, my wife is on it 7 weeks now. Is it safe? So Vibriid is what's considered a pregnancy 3 drug. So let me explain. When we're rating drugs to be used for a woman who's, pregnant, we need to figure out a whole bunch of stuff to determine its safety. How long is it in your body, which is the half-life? How big is the molecule? Because the bigger the molecule, the less likely it is to pass through the placenta. Is it fat soluble? Is it water soluble? All these different things. Vibriid is not a very commonly used antidepressant. We consider it a pregnancy 3. So pregnancies 1 and 2 are considered safe. Pregnancy 4 and 5, not safe, cannot use. Pregnancy 3 is a risk versus benefits one. This is where we need to really look and see what's going on. Vibriid the animal studies that we can find on Vibriid shows that the animals had some low birth weight and they might have had slower maturity and decreased fertility. This is what makes it a category 3. Now, the biggest thing you need to know is that just because you heard me say that does not mean that's a guarantee as to what's going to happen. It means those are the risks that we're seeing in animal studies. Now, what we can tell you is untreated anxiety and depression puts you at a very high risk for miscarriage, stillbirth, and preterm birth. And the evidence also says that even the highest risk antidepressants, if that's the only thing that helps the mom and reduces all those stress hormones that are going through her body, that should be in consideration for use in order for her to have a healthy pregnancy. All these medications are risks. They're not guarantees. And so that's why it requires a very long thought out discussion with your healthcare provider about its use. All right. We got this great question on my formula feeding video. And I thought this was a fantastic question. And I actually recently was working with a mom in my office, and this reminded me, about this. And I've worked with many moms over the years that have had this kind of situation. So it was on the formula feeding video, and it said, I'm a new mom. My baby is underweight. He is 1 month old and just 2 kilograms. The doc told me to start formula milk as my milk is not thick enough to increase his weight. I am watching this video to start bottle feeding formula. I'm a vegetarian. Please kindly guide my diet to improve my milk. So, generally speaking, women's breast milk will always be nutrient dense enough to feed a baby. It will always have enough sugar, enough fat, enough protein. It is extremely rare for a woman, even if she's starving, to not produce the right amount of breast milk to feed her baby. And that has been evidenced over decades of us seeing women starving through famine and being able to breastfeed their babies, who are barely eating enough calories in a day to keep a human being alive. And they're able to make a full, robust breast milk supply. So I'm going to tell you, it is extremely rare, no matter what diet you eat, that your breast milk will not be quality enough to allow your baby to grow. So if I am correct, what is going on? I suspect this baby is tongue-tied. So a lot of failure to thrive babies, what happens is the mom's breast milk quality is blamed. The mom is told, you're not making good milk, you need to change your diet, and it's not that. It's that the baby is unable to transfer milk out of the breast because the tongue is anchored down. So there's a couple different types of tongue ties. The first is a anterior tongue tie. So that means front. Anterior is front. And the anterior tongue ties are the ones that when the baby lifts the tongue, you see that string that looks like spaghetti right there. And we just snip it and it's done, right? You can also see an anterior lip tie here, usually very obvious. Now, these ones are extremely uncommon. This is the problem. People think those are the common ones. They're not. They're very, very uncommon. And so if your baby does not have that, a tongue tie will be missed. There's something called a posterior tongue tie. So a posterior tongue tie is further back. And a posterior tongue tie is a thick band that goes underneath. So the baby can actually lift the front part of the tongue and you see tissue, but if you don't know what you're looking for, if you don't know the mechanics of how a tongue is supposed to work, then you wouldn't necessarily know your baby has this. If you see any type of labial tie, that's where you flip the lip up and you'll see that piece of tissue there. The baby has a posterior tongue tie, I promise you. If this tie is left untreated, the baby is not going to be able to transfer milk out of the breast. The tongue does not move the right way. The baby will get fatigued. The baby will take a very long time to eat. And then what happens is your quality of milk is fine, but your milk supply drops. So now not only is the baby not able to get the milk out, you don't have enough breast milk to feed the baby because the baby isn't stimulating you. Okay. I feel this is one of the biggest things that gets missed. And this is one of the biggest reasons why women end up stopping breastfeeding because they're told their milk isn't good enough and it has nothing to do with their milk. What can you do to thicken your milk? Make sure you're eating a healthy vegetarian diet. So you can absolutely continue to eat your vegetarian diet. Just make sure you are getting enough protein. So just really look at your protein and making sure you're getting whole protein. I am not as familiar with a vegetarian diet as I am others, but like I do understand that not every single combination will give you an actual whole protein. The example I could say is you need to eat rice and beans together. Otherwise, you don't have all the amino acids to create the protein. If you are willing to eat eggs, add eggs in and eat more of them. If you're willing to eat fish, like a pescatarian type of thing, eat more of that, okay? But make sure your protein quality is good and make sure your fats are healthy fats like, olives and avocado and stuff like that. Now, you probably need to work with a lactation consultant to see how much milk you're actually making and also to see how much milk the baby's transferring. You may find that that's actually the issue. And if it is a tongue tie, you need to go probably have that revised or you're probably going to end up needing to bottle feed the baby because the baby's just never going to be able to take the milk out of your breast. However, pumping is an option. So I want you to consider that. And I thought that was a great question. I'm really glad that you asked because I think a lot of people aren't aware of that. We had a question that came up on antibiotics, and it said, is it safe to take cloxacillin? I am 10 weeks pregnant. So I'm currently looking up the medication right now. And one of the things that we use as healthcare providers is a drug guide that was put out by Thomas Hale, who is a pharmacist who takes and puts together all of this stuff. And I like to mention him because he should get credit for his work, but also because I want you guys to hear what he is. He's a pharmacist. So if you guys aren't sure about a medication that's been prescribed to you, one of the other places that you can check is with your pharmacist because your pharmacist has gotten specialized training in medication. They can help guide you on the safety of medications that's been prescribed to you. Cloxacillin is safe for use during pregnancy. So this is a really good option for antibiotics. I had a question about Thrush. So it came in on my yeast infections for breasts and it said, where can I get checked for Thrush? Is it the OBGYN? So this is a very interesting thing. So Thrush is actually, there's not a true way to diagnose most women with a yeast infection of the breast. And we have our video on that. We'll link our yeast infection video for breasts into the description. But basically, usually what'll happen is you have shiny, flaky skin on the nipples. You'll feel this like itching sensation, and then sometimes you'll have deep, sharp stabbing pains, okay? Those are kind of the signs of thrush. We treat it based off of your symptoms because sometimes they'll take a sample of your breast milk to try to get like a culture of the yeast, but it's very rare that we can do that. So what you need to do is call your OBGYN, tell them what the symptoms are. They will probably prescribe a medication. What's very important for you guys to understand is if you are being treated for a yeast infection of the breast, you need to make sure that the baby is treated as well if you are breastfeeding. That's why I want you to watch that video. If you have a yeast infection in your breast and you are breastfeeding that baby directly, that baby has got a yeast infection in the mouth. Guaranteed, 100%. So if you get treated but not the baby's just going to give that yeast infection back to you. If your baby gets treated and you don't, you're going to give the infection back to the baby. So you both have to get treated together. What's interesting about this now is that there's sometimes the pediatrician will actually give you the medication to treat your yeast infection. Every pediatrician is different, but some of the times when they're treating the baby, they'll give you the prescription. It's usually diflucan, which is a pill, and they give it to you for like a week. When you have a yeast infection of the breast, you don't take it for one day like you do a vaginal yeast infection. You take it for like a week. So that was a good question. For those of you who are joining us, please remember, feel free to put any questions you have into the chat. I did have a question. 4 days before conception, I took 10 capsules of itraconazole for a yeast infection. What may go wrong? So this question was a really good question. So I'm going to start by answering the specific question. Itraconazole is considered not safe for pregnancy. Okay, we do not want to use it if we can help it. There are no indications that it causes birth defects, but there is some evidence that it might cause miscarriage, just a slight increased risk of miscarriage. So we try to recommend that you do not take this medication unless you absolutely have to. Now, in this case, this viewer did not know they were pregnant when they took this. So there's nothing you can do. You just and everything. If you suspect you're having a miscarriage, you want to go ahead and just let your healthcare provider know immediately. This question highlights something very important. Okay, so for anybody who's still here, for anybody who listens to this, please share this information with everybody you know. If you are a woman of childbearing age and you are not using birth control, okay, unless you're using a pill, a condom, or surgical methods, if you are just rhythm method, pulling out anything else, you are not using birth control. You need to ask every healthcare provider you meet to medicate you as if you were pregnant. Again, if you are of childbearing age and you are not practicing safe sex using birth control, this means there's a chance you could get pregnant. If there's a chance you could get pregnant, you want every provider you meet, even if you're not planning on getting pregnant, to medicate you as if you were pregnant. That way, if like this particular viewer, a pregnancy happens by accident, you will have been given safe medications for pregnancy. Every week, I answer questions from people who say, I took a medication and then I found out I was pregnant. It's very scary. And this is a simple fix. As healthcare providers, we should be asking you, are you using birth control? And if you're not, we medicate you as if you were pregnant. I pretty much, every woman I meet who's between 15 and 50, if she tells me she's not using birth control, I pretend she's pregnant when I medicate her. And that's so that I know I'm giving her a medication that's safe in case she gets pregnant. And that's how you want everybody to be treating you. Another question that came in on the yeast infections. I am 8 months pregnant. I feel itching after urination. Is it a yeast infection? So the answer is, I don't know. Itching is one of the signs of a yeast infection, and you need to call your healthcare provider and ask them to test you. So anytime you have any kind of discharge, anytime you have any kind of symptoms, you need to go get tested right away. We need to look at all that stuff, and we need to make sure we know what's going on. All the different infections, urinary tract infections, yeast infections, sexually transmitted diseases, these can all lead to miscarriage, preterm birth, and stillbirth. The way we determine what you have, we take a little sterile swab, we swab you, get up some of that discharge, and we send it to a lab to determine. If it's a yeast infection, there's tons of things that we can give you. But the other thing you need to know, and for a lot of you, is that itching could be from a hemorrhoid, and we have a hemorrhoids video. We will link that into the description. Those are very itchy sometimes. It could also be some kind of actual topical dermatitis, like an allergic reaction. So I get a lot of questions about bleeding every week. Bleeding is extremely scary. Most of them are bleeding questions in the first trimester. And what happens when you become pregnant is your hormone levels change to sustain a healthy pregnancy, right? And those hormonal changes, they thin out the vaginal tissue. So then when you are having sex, or when you strain going to the bathroom, or even when you wipe too hard, you might bleed, right? Well, that thin vaginal tissue, if you think about it, it's kind of like a little bit more raw, and it's definitely more sensitive. And what can happen is, let's say you've always been washing your underwear using Tide detergent, and it has that fresh scent to it. Well, even though you were never allergic to it before, you might be allergic to it now. And as a result, you may have all different types of symptoms, including itchiness. Another thing that can happen is you may have always worn the sexy, silky underwear. Okay, that sexy, silky underwear is not a natural material, and it doesn't allow the vagina to breathe. And good vaginal health means your vagina needs to breathe air. It cannot be wearing all these unnatural fabrics. And so if you look at like the yeast infection video, and I believe the urinary tract infection video, I mentioned you need to use cotton underwear. I know it's not sexy, but your vaginal area has changed. The vaginal bacteria is different. The hormones are different, and you're going to be at higher risk for stuff like yeast infections and urinary tract infections. And one of the most homeopathic ways to prevent that, ladies, if you can go bottomless, go bottomless. Don't wear underwear at night. And when you do have to wear underwear, you want to wear cotton underwear. It's a lot better for your vaginal health, okay? So that's another thing. So I had a couple bleeding questions. We're almost at the end. And for those of you who stay, I'm going to tell you what my video is for tomorrow. So I am 6 weeks pregnant, and I had a brownish discharge and medium material push away from my private parts and some red blood in my urine. What does it mean? So when we are talking about blood, we're talking first about colors. And I put out a video on actually the different colors you can see when you're bleeding. I'll link that into the description, because the colors are so important to tell you what's going on. Brown is old blood. This means that something had happened in the past and the bleeding is now resolved, and that's what you're seeing. A meaty type of discharge, to me, that sounds like a blood clot. Now, that to me, those two things sound like a possible miscarriage. Whenever you see any kind of bleeding, whether it's brown or red or pink, you need to call your healthcare provider. You need to tell them what's going on so that they can do an ultrasound to determine the cause. Sometimes we think that what we're seeing is the signs of an miscarriage, and it's not. It's something completely differently. But that's what that sounds like. Unfortunately, it does sound like a miscarriage. You want to go ahead, and if you're suspecting miscarriage, you want to let your healthcare provider know so they can do a blood test to determine if you're still pregnant. We had another question. I have brown discharge and I'm 5 weeks and 5 days. What is causing it? So again, this sounds like bleeding. I'm guessing this is resolved bleeding. So what are some of the common causes of bleeding? You can have bleeding from from sex, as I told you. You can have bleeding from hemorrhoids. You can have bleeding from something called a subchorionic hemorrhage, and we have a video on that. But the subchorionic hemorrhage is like this pool of blood on the backside of the placenta, and when it attaches to the uterine wall, some of that blood may seep down, and you see that on your pad. That is one of the causes that we can see on ultrasound. So if you come into the hospital saying, hey, I'm bleeding, they'll do an ultrasound and you can see that. So then we know what's going on. And then we had another question. On October 16th, I had my period. On the 30th and the 31st, I had unprotected sex. On November 1st, I'm bleeding. So this sounds like somebody who's telling me she's pregnant and now she's bleeding. Guys, if you're bleeding, you need to go get checked out. So depending on how far along you are, there is a lot of things we can do. And so we had a woman say, I'm 22 weeks pregnant, and up and now my pregnancy has been smooth, but today I got 1 drop of blood in my panties. Is it normal? So it might be normal. A lot of this bleeding might be normal. Again, there's so many normal causes of bleeding, as are mentioned in some of the videos. But there are things that are not normal. And if we know about them early enough, we can try to prevent stuff. So for my 22-weeker who saw the drop of blood, she might have something called a placenta previa. So placenta previa is where this is your cervix and the placenta goes over the cervix instead of being on the side of the uterine wall. And this, when the cervix dilates, becomes a medical emergency. So make sure you guys are getting checked out, all of your bleeding stuff so that we know what's going on, okay? So we have come to the end. So my name is Dr. Samantha. I am the maternity mentor. I'm here every Monday at 9 p.m. Eastern Standard Time to answer your questions. We are on Facebook, Instagram, and Twitter for additional content. We will link those into the description. Please share this channel with your friends and family. Follow us on all of our social media platforms. Please like and subscribe to the channel and hit the notification button. That really, really helps me out, guys. Please come back every Monday at 9 p.m. Eastern Standard Time. I love hearing from you guys. I love answering your questions. This is actually one of my favorite things to do. And now for tomorrow's video. Tomorrow's video is a guide on the most common postpartum complications that you might experience. So it talks about what you might see, what are the warning signs, what's causing it, so you can go and get the treatment. And you can take care of yourself, because a lot of women aren't told some of the very specific complications that could happen. So I hope you guys check it out. It will be there. And we have other exciting videos coming. And also remember, guys, if you ever want a video on something, please, you can tell me here on Monday nights. You can also hit up any one of my videos, any one of them. And in the description, you put a comment and say, hey, I would love to see a video on this. I will see that. I look at all of my comments and I will make a note of it and try to get one out for you guys. I really appreciate all of your support, guys. Thank you so much for being here. My name is Dr. Samantha. Bye for now.